Hello, friends. If you're over 60 and completely confused by senior health insurance, you're not alone. Between Part A, Part B, Advantage plans, Medigap, coinsurance, and drug coverage, it's enough to make anyone want to give up before they even begin. But in this video, I'm going to break it all down for you, clearly and simply. We'll cover what each part means, what it costs, how to compare plans, and where to find trusted help. No fluff. No scare tactics, just straight talk. Let's start with the basics. What exactly is Medicare? Medicare is the federal health insurance program for people age 65 and older. You can also qualify earlier if you have a qualifying disability or condition like end-stage renal disease. But for most people, Medicare kicks in around your 65th birthday. Now, Medicare is divided into 4 parts. This is where things can get confusing. But here's a simple breakdown. Number 1. Part A, hospital insurance. This part covers inpatient hospital care, skilled nursing facility stays, hospice, and some home health services. Most people don't pay a monthly premium for Part A if they paid Medicare taxes for at least 10 years. But there are still deductibles and coinsurance you may owe during a hospital stay. Number 2. Part B, medical insurance. This covers things like doctor visits, lab tests, outpatient procedures, physical therapy, preventive screenings, and durable medical equipment like walkers or oxygen. In 2025, the standard monthly premium is $174.70. There's also a yearly deductible and 20% coinsurance for most services. Together, Part A and Part B are called Original Medicare. This is the traditional plan offered by the government. You can go to any doctor or hospital that accepts Medicare. No networks, no referrals. But Original Medicare doesn't cover everything. That brings us to Part D. Number 3. Part D, prescription drug coverage. This is an optional plan you can add to Original Medicare. It helps cover the cost of prescription medications. Plans are offered by private insurance companies, so costs and drug coverage vary. The average monthly premium in 2025 is about $30 to $40. But here's the good news. There's now a $2,000 out-of-pocket cap on prescription drug costs each year. That's a big help for seniors on multiple medications. Now, if all of this feels like a lot to manage separately, there's another option: Medicare Advantage. Number 4. Part C, Medicare Advantage plans. These are all-in-one plans offered by private insurers. They combine Part A, Part B, and usually Part D into one plan. Many also offer extras like dental, vision, hearing aids, or fitness programs. Medicare Advantage plans often have lower monthly premiums than Original Medicare with a Medigap policy, but they come with some trade-offs. You must use a specific network of doctors, and you may need referrals to see specialists. Some plans also have higher out-of-pocket costs if you get sick or need a hospital stay. So which should you choose? Original Medicare or Medicare Advantage? Let's break it down. Original Medicare gives you flexibility. You can see any doctor nationwide who accepts Medicare without worrying about networks or referrals. You can add a Part D drug plan and a Medigap policy to help with costs. Medigap, also called Medicare Supplement Insurance, helps pay for things that Original Medicare doesn't, like deductibles, copays, and coinsurance. It doesn't cover prescriptions, dental, or vision, but it can reduce your out-of-pocket risk. Medicare Advantage, on the other hand, is convenient. Everything is bundled into one plan, and you may get added perks like dental or transportation. But it limits your provider options. You must stay in-network unless it's an emergency. Cost-wise, here's what to expect. Part A is free for most people. Part B costs about $174.70 per month in 2025. Part D averages $30 to $40 per month. Medigap plans range from $100 to $300 per month. Medicare Advantage plans may have $0 premiums, but can include copays and deductibles. And here's what Original Medicare does not cover: routine dental care, vision exams or glasses, hearing aids, long-term care, such as assisted living or nursing home stays. Emergency care outside the U.S. Some Medicare Advantage plans include limited coverage for these services, so if they're important to you, be sure to read the plan details. Now let's talk about how to sign up. When you first become eligible for Medicare, you have a 7-month initial enrollment period. It starts 3 months before the month you turn 65, includes your birthday month, and ends 3 months after. If you miss it, you may have to pay a penalty, so don't wait. There's also the annual enrollment period every year from October 15th to December 7th. That's when you can switch plans, change from Medicare Advantage back to Original Medicare, or sign up for a new drug plan. And if you already have a Medicare Advantage plan, there's a separate window from January 1st to March 31st to switch to another plan or go back to Original Medicare. So, where do you go for help? Start with SHIP, the State Health Insurance Assistance Program. It's free, unbiased Medicare counseling, available in every state. Visit shiphelp.org to find a local counselor. You can also visit medicare.gov, the official site, to compare plans, check your eligibility, and enroll online. Or call 1-800-MEDICARE to speak to a representative anytime. If you'd rather talk to a broker, just make sure they represent multiple companies and aren't pushing one plan over another. And finally, don't panic. You don't need to be an expert. You just need a clear understanding of your options and how they fit your health needs and your budget. Here's the bottom line. If you value flexibility and don't mind managing separate parts, Original Medicare with a Medigap plan may be best. If you prefer one bundled plan and don't mind network restrictions, Medicare Advantage may suit you better. Still unsure? Here are a few practical tips to help you decide. First, make a list of your current doctors and medications. Check if those doctors are in-network under the Medicare Advantage plans you're considering. If not, Original Medicare may be the better route. Next, consider your travel habits. If you spend time in more than one state or travel frequently, Original Medicare gives you more freedom across state lines. Medicare Advantage plans may restrict you to emergency-only coverage outside your service area. Also, take stock of your budget and how much you're willing to spend out of pocket each year. While a zero-premium Medicare Advantage plan sounds tempting, you'll want to check the plan's deductible, copays, and annual out-of-pocket maximum to avoid unexpected expenses. If you're tech-savvy, use the Medicare Plan Finder tool on medicare.gov to compare up-to-date plan benefits, costs, and provider networks. You can even input your prescription list to see how much you'd pay under different plans. If you want someone to walk you through it, your local SHIP counselor can provide one-on-one help, either in person or by phone. Many communities also offer free Medicare education workshops at libraries, senior centers, or clinics, so check around locally. And remember, your situation may change. Just because one plan worked for you last year doesn't mean it's still the best choice today. Review your plan options every year during open enrollment to make sure you're still getting the coverage and value you need. One final reminder, scammers target seniors during Medicare enrollment periods. Never give your Medicare number or personal info to anyone who calls or emails you out of the blue. Only work with trusted, verified sources. If this helped, please give the video a like so others can find it. And don't forget to subscribe for more clear, simple guides to health, wellness, and aging with confidence. Thanks for watching, and we'll see you in the next video.